A few muscles of the facial expression, muscles of facial expression. So let us see which all we can see, small muscles. So first we removed out the scalp, and what we can see, the fibers of the frontalis belly of the occipitofrontalis muscle of the scalp. So these are the fibers in this direction that are here in the layers of the scalp. Then here we can see the rounded, these are the muscle fibers. Can you see this? This is the rounded fiber, right? This direction. So these are the orbicularis oculi. So this is the orbicularis oculi. Then below we can see pad of fat, loose areolar tissue, dependent area below the eye, where you can see the renal edema very easily. Then we have one important muscle, that is the zygomaticus major, from zygomatic area to the lip area. So this is the zygomaticus major. Then here these broken fibers we can see here, these are zygomaticus minor. Okay, these are the zygomaticus minor. Then these are the broken fibers which connect between the region of the orbicularis oculi and orbitalis. So these names which will elevate. So the name is levator labii superioris. So these are the broken fibers because they are mixed with the fatty tissue, the adipose tissue. So we are not able to trace them easily. They are superficial thin muscles. So they have got broken when we have tried to dissect out. So this is the levator labii superioris. Okay, here we can see the blood vessel. This is the lumen of the blood vessel. This is the lumen of the blood vessel, branch of the facial artery, etc. in the superficial area. Okay, then we can see these muscles. So these fibers that are broken, these were the superficial layer. So this was the rhizorius muscle. Rhizorius muscle responsible for smiling. When we removed this, we were able to see these muscles. This is the buccinator muscle. This is the buccinator muscle, blowing muscle, whistling muscle. Then this is the masseter muscle. Then here we can see. So this is the this is the platysma muscle. This is the platysma muscle fibers which are stuck here. This is the platysma muscle. Then these fibers we can see, these are the depressor ones. So that is the depressor anguli oris. Depressor anguli oris. And here is the fatty tissue, the connective tissue. If we remove this, we can see fibers of the mentalis here. Mentalis from both the side come and they fuse in the symphysis menti area. So this is the mentalis muscle. So this is all about the depressor anguli oris and depressor labii inferioris and the mentalis muscle. So this is all what we can see.